everyone, and thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I'm Kathy Riley, the Associate Director of Programs at CSCLA, and I am really honored to welcome you to this week's webinar titled Beyond Loneliness, Social Health After Cancer. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer. And that includes patients, caregivers, and their loved ones, all at no cost. And our programs include support groups, healthy lifestyle classes, social activities, and educational programs like this one. And if you would like to learn more about our services or watch past webinars, you can visit our website at cancersupportla.org. And before I introduce today's speaker, note that your video and microphone are automatically disabled for this webinar, but you can enter your questions into that Q&A feature that's found at the bottom of the Zoom window at any time. And we invite you to populate that Q&A with questions all throughout the webinar. And the questions will be answered at the end of the presentation. We may not be able to get to all your questions today, but our presenter has generously offered to share her contact information at the end of the webinar. Dr. Kimberly Miller is an associate professor at the Keck School of Medicine of the University of Southern California. Her research focuses on health behaviors, healthcare engagement, and quality of life among diverse young adult cancer survivors. As principal investigator on 2 National Cancer Institute-funded studies in this area, she employs behavioral, epidemiological, and implementation science approaches to inform clinical practice and policies. Dr. Miller is also a founding co-director of the Center for Young Adult Cancer Survivorship Research, a collaborative initiated dedicated to improving health outcomes for young adult cancer survivors. And it gives me great pleasure to welcome today's speaker, Dr. Kimberly Miller. Dr. Miller, welcome.
Thank you so much, Kathy. So honored to be here and happy to be able to talk to everyone. Okay, let me share my slides and begin. Okay. Hopefully everyone can see this. So welcome, and I want to thank everyone for attending. My talk today is entitled Beyond Loneliness, Social Health After Cancer. As Kathy said, my name is Kim Miller. I'm an associate professor at University of Southern California and the USC Norris Comprehensive Cancer Center. And to be clear, I am a PhD. I am not an MD, and I'm going to talk today a bit about my research, but really about this issue of social health and social connection. So to begin, I want to talk a little about, just to give you some context about what my research focuses on. I focus on young adults who have been diagnosed with cancer. And young adult, by young adult, what we mean, or what National Cancer Institute of National Institutes of Health defines that as, is diagnosis under the age of 40. Why do I focus on this specific cancer population in this age? Young people facing a cancer diagnosis are a unique and particularly vulnerable cancer survivor population. They have distinct medical and psychosocial issues compared to older adults. We know that having cancer at any age is a challenge. It presents emotional, medical, physical, financial, logistical challenges. But when you're young, there's a series of things, and because of the life stage that you're at, that can be disruptive to this sort of initiating part of your life. So there's a graphic that you can see on the slide that's from a Institute of Medicine report, which shows the many different kinds of life disruptions that young people can have. And that can include, career, their vocation, their schooling, issues of self-esteem, body image, and their relationships, social relationships with family, with peers, with romantic partners. And I'm going to talk a bit today about that topic, about what happens to one socially after cancer. But I want to first back up and say, let's just talk a bit about social connections, not in the context of cancer, but just as human beings. We have some 50 years of robust evidence that the effect of social connection on health is important. It's critically important, social connection and social disconnection, so that our relationships or lack of relationships actually can impact and predict health outcomes. And I'm going to talk a little bit more about that in a moment. But I want to draw your attention to last year, our Surgeon General, Dr. Vivek Murthy, produced a Surgeon General's advisory entitled Our Epidemic of Loneliness and Isolation. And this is easily found on the web. And if you can't find it, email me and I'll send you the PDF of this. But if you're interested in this topic, I encourage you to read it because this is a very, very good report. So if you're familiar with the Surgeon General's office, you'll know that they don't usually just issue annual reports, or this is a unique thing. In other words, the Surgeon General issues an advisory when they believe there's an issue of critical public health importance that they want to raise attention to. So Dr. Murthy issued this report basically because he felt that loneliness and isolation was a critical health issue in the United States and wanted to raise awareness and make sure that individuals, the research community, and people who were in a position to help reduce this epidemic were activated and aware. And so some of what I'm talking about comes from this report, but really the report draws from this 50 years of research and evidence on the relationships between our social relationships and our health. So I've been using these terms like social relationships, social connection, social health interchangeably, but actually what I want to emphasize here is that social connection or social health, this is an umbrella term, and that there are very distinct concepts within that we study and that are important to differentiate and not to kind of conflate and use interchangeably. So I'm going to point these out to you. And I think it's important because for a couple of reasons. From a scientific perspective, it's important for us to understand exactly what we're studying and what has the impact on specific health outcomes. But I think it's also important to, when we think about our own social existence, our existence as human beings in a social world, it's important to understand that these are distinct different concepts. So let's start with loneliness. Loneliness is actually a perceived and subjective state. We feel lonely. And the only way we can find out if someone is lonely is if we ask them if they're lonely, right? Because it's an emotion, it's an emotional state. One feels lonely. But by contrast, social isolation is an objective lack of social interaction. So it really means that you have, few and infrequent contacts or connection if you're socially isolated. So interestingly, one can be socially isolated but not feel lonely because your isolation may be by design. And conversely, one can be surrounded by people and feel lonely. One can be not isolated at all, but still have that feeling of loneliness. Then there's social support. So social support has been well studied, and especially has been studied in the context of cancer and other serious illness. And social support is the type of support that one receives and also that one provides to other people. And it's broken down into different categories. We categorize social support as emotional, tangible, and informational. Emotional support is just what it sounds like. You're, talking to a friend, you're unburdening yourself. They're telling you, they're giving you words of support and helping you. Tangible support is really in the realm of doing an action that is helpful, a supportive action. So, for example, I need a ride to my doctor's appointment and I can't drive myself. And, I reach out to a friend and ask, will you drive me? And they drive me to the appointment. That's a form of tangible support. Informational support is when um, someone is giving you information that supports some aspect of your life. So, maybe you have your um, in treatment, and you have a certain side effect of treatment, and so you go onto an online support group and you say like, I'm taking a specific chemo, I have a bad rash. What can I do about this? And people give you some information that helps you. Importantly, with social support, it's both positive, it can be received positively, but it can also be received n negatively, meaning social support can be helpful, perceived as being helpful, or can be perceived as not being helpful. So we know, for example, in the last example I gave with information, after a cancer diagnosis, there's a lot of information that people like to give. Some of it's helpful, but some of it is really not helpful. And what we found over time is that, unsurprisingly, when you receive social support and you perceive it as being helpful, that is related to better outcomes rather than just the support that people are giving you, which you don't perceive. So on the bottom here, the bottom three, we're moving into areas that are more of social structures, not so much at the individual or interpersonal level, but social networks is actually very fascinating. We are all involved in different types of networks that are the patterns of ties of relationships that we have with others. And I'm going to show you a social network later. But for example, um, by if we work, we have people that we talk to regularly, we have friends at work, those friends have other friends, we have certain confidence, and we can actually graph that to see who we know and who knows who and what the sort of, our networks have characteristics and we have overlapping. And some of us have very large social networks, some of us smaller, but these patterns that we find actually are related to health outcomes. And then there's social integration, and that's, again, one's integration into the social structures that exist and the involvement in activities that one participates in with others. And so an example of this might be, it's not limited to this, but this is an example I can think of is, let's say one has immigrated to another country. And that other country has, you know, social structures ranging from, integration as a citizen, integration as, into medical care, into schooling, into work. And so we can measure the extent to which that person becomes involved and integrated into as a social being into these structures. And finally, there's social capital. Social capital is probably of all of these, there's the least consensus on what this means, but I understand it to mean the advantages and resources that are available to us that we have through social relationships. Now, an example might be, I work at a hospital. I work at Keck and Norris, and let's say I'm diagnosed with cancer, and so I decide I want to get in to see Dr. Superstar, who doesn't take many patients, or there's a long, long waiting period. So I call my friend who's an oncologist, and I say, "Hey, can you help me get in with Dr. Superstar?" And through this social tie that I have, through my relationship, I get a favor and I'm able to go see Dr. Superstar. So in that way, I have greater social capital, which is, I have an advantage. This can happen, and by the way, I don't. That was a completely hypothetical example, but just to show you that some people have greater social capital and advantages and resources than other people. So if you don't have it, it can disadvantage your health. It can be a disadvantage. So what are the health issues that are connected with these different facets of social connection? And again, we are talking about, some 50 years of robust and global, really global research with very, very large data sets. And I would say that I'm going to use my pointer. The first and most important one is mortality, all-cause mortality. So the lack of social connection, higher loneliness, greater social isolation has been across studies linked to and predictive of premature death. Cardiovascular disease and stroke are two other disease conditions that have been highly linked to the lack of social connection, again, across studies. Impaired cognitive function, and by here I'm really talking about dementia and Alzheimer's. We've seen that people who have, again, greater social isolation, higher levels of loneliness, um, that it's associated with onset of Alzheimer's dementia. Depression, unsurprisingly, and other, mental health challenges, but also infection and diminished immunity. Um, we see that, people who have lower levels of social connection tend to have worse immune function, um, greater susceptibility to infectious disease and influenza, and of course, sleep issues. And all of these are related. Sleep is very critical to, immune system, cardiovascular disease, even to mortality. So all of these are also interrelated. And we find again that the lack of social connection can lead to these poor health outcomes. And how does that happen? So we've identified a path, three processes that are all interrelated by which our social connection or lack of it affects us, the processes which then affects our health. And the first one is biological. So our lack of social connection can actually affect us biologically. It can affect our stress hormones. It can affect our cortisol levels, our adrenal levels. It can lead to, and there's been a lot of research now looking into inflammation. And of course, inflammation is a process which, is linked to many different conditions, including cardiovascular disease, including cancer. Um, and, overall, it seems that it depresses our immune system, has been linked with the gut and microbiome. Also, psychologically, our lack of social connection or our good social connections can affect us psychologically in terms of, giving us meaning and purpose in life, but also um, putting us in a sense of feeling hopeful or hopeless, safe or resilient. What ends up happening psychologically is that can interplay with our biology and or interplay with the third processes, which is our health behaviors. So our behaviors are critical to our health promoting behaviors. So for example, our lack of social connection may make us depressed, which then reduces our physical activity, maybe reduces our, nutritional level, and increases the chance that we may engage in things like smoking or substance use, excessive drinking, poor sleep. So these processes, biological, psychological, and health promoting or health risk behaviors all work together as a result of the impacts of social connection to lead to those health outcomes that I just showed. So let me give you some sobering, I mean, for me at least, these were sobering statistics from the US Surgeon General's report. And again, I've been working in this area since about 2019, but this even shocked me because they are up-to-date reports from last year. And I will say that although we, have recently gone through COVID, which of course was know, um, uh, an, uh, an issue where many of us experienced a lot of social isolation. This predates COVID. This is generally speaking, COVID exacerbated a lot of the trends that I'm talking about here, but it is not responsible for them. Okay, this predates COVID. COVID was just, a sort of exacerbation of it. But approximately half of you as adults report experiencing loneliness. So that's 1 in 2 of us. Um, and some of the highest rates are reported among young adults. I say that because oftentimes the research in social isolation and loneliness have focused appropriately on older adults because older adults often experience more isolation. It's a phase of life where they may be losing people, losing partners, changing living environments, but young adults are experiencing this epidemic of loneliness as well. And this is a trend that's been happening even before COVID, as I said. But let's look at that compared to some of the other critical health issues that we face in the US. So again, 50% of adults reporting loneliness, which we know leads to some critical health outcomes, including premature death. That's compared to 13% of US adults who report smoking, 15% with diabetes, and 42% who have obesity. So smoking, diabetes, and obesity, we know in and of itself are, themselves um, outcomes that are poor, but they also lead to poorer health outcomes. They lead to greater, disease conditions or mortality, but there's still the prevalence of them is still lower than the half of US adults who report loneliness. Loneliness and social isolation increase the risk for premature death by 26% and 29%, respectively. So nearly 30%. And recently it's been calculated that the mortality impact, or how much we can attribute to premature death of social disconnection, is similar to that caused by smoking about 15 cigarettes a day. So social disconnection is comparable on your health as kind of smoking a pack of cigarettes a day. So it really is a critical issue, and one that we are struggling with as a country. We're not the only country struggling with this, but um, if you read the Surgeon General's report all the way through, you can see that Americans today are struggling with this, and some more than others. So let's talk for a moment about social connection in cancer. This is a cancer support group. I'm a cancer researcher. And what I want to posit is that after a cancer diagnosis, almost all of us face social changes, a difference in our social relationships. They can be negative, they can be positive. One's loneliness may be increased as a result of the cancer diagnosis, and one's isolation may be increased. And this could be because of psychological issues or a lack of someone in your life to talk to, or someone who doesn't understand what you're going through. Or it could be a result of just, purely medical issues of long hospital stays, being immune compromised and having to stay at home. On the other side, it actually can be that sometimes after a cancer diagnosis, social relationships take on a new meaning. We may draw closer to our family, to our partners. We may draw closer to friends. We may have increased social support from people, and we may in turn give social support. We may, engage in cancer support groups where we offer social support to people. And our social networks may change. They may change in which they may get smaller, and we have fewer contacts, but stronger contacts, stronger ties with people. That's one thing that we see sometimes. Or they may expand greatly because we may be engaging in, you know, support groups in person, online, or, it may open a new world. So I would suggest that it's hardly ever neutral, our social relationships. It hardly ever stays the same after cancer. It can change. It can change for the worse and it can change for the better. It can be positive or negative, but we need to, as researchers, we need to understand this and what happens so that we can support those who need it and we can help improve outcomes for cancer and for health, because we already know, as I said, we have robust evidence that social connection impacts our health. So now I want to talk to you a bit about the study that I'm leading here at USC, which focuses on this issue of our social relationships in young adult cancer survivors. So my study, it's a 5-year study funded by National Cancer Institute, and it's entitled Social Health, Activity Behaviors, and Quality of Life Among Young Adult Cancer Survivors. And I'm going to unpack that long title for you all and tell you what really the study is intended to do. First, I want to say that young adult cancer survivors, many cancer survivors, but particularly young, as I described, this unique and vulnerable population, have a lot of difficulty with their social relationships after cancer. And these are mostly smaller studies, cross-sectional, where we measure things at the same time, or in qualitative, where we interview patients, but they report that they have problems initiating, maintaining, and developing their friendships after cancer. They have a difficult time disclosing cancer to others. You know, they often say, I'm starting a new job. Do I tell them I have cancer? I'm dating a new person. When do I tell them that I've had cancer? That is a really critical and difficult issue that young people have with cancer. We found that, what is related to worse social outcomes tends to be high symptom burden and poor physical function, worse mental health outcomes like depression after cancer, having a negative body image related to cancer treatment and surgeries and the impact of cancer on the body, and cancer related stigma that people experience from others when they've had cancer. These are associated with worse social outcomes. So I wanted to study all of that. And the reason I did is because I, from it's a very personal reason, but it has to do with a close friend of mine, my best friend, in fact, who was diagnosed in her 30s with breast cancer. And I witnessed something that am, it's what I hypothesize, it's called the vicious cycle. I saw it happen to her and I wanted to study to see if it happened to others so that I could help to contribute to maybe intervene at some point. And here's what I saw. So my close friend was diagnosed with breast cancer. And this is a person who is extremely socially integrated, has a lot of social capital, a lot of friends. She's a professor. Um, she's very active. She goes out to lunch and out to dinner, big friend group. She's in a hiking group, and just really is, a sort of a social person. After her diagnosis and once she started her chemotherapy, her social connections started to go down, meaning she became both lonely and socially isolated. Now, one thing I should say is I live an ocean away from her. She is Korean, she lives in Korea. So we were texting a lot and we met in graduate school, but I was sort of providing social support through text. But she was describing that, she just no longer felt like going out to lunch and to dinner. She was too tired and she was experiencing a lot of neuropathy on her feet. So it kind of hurt to walk, and she just didn't want to see people. There's a lot of social stigma, cancer-related stigma in Korea. She just didn't feel like going out. As a result, her activity level started to drop. And when I say activity, I'm not talking about exercise necessarily or physical. I'm not saying like beach volleyball, or like running marathons. I'm talking about walking activity, just getting around. She just wasn't going out of the house. And, she wasn't really moving very much because she was so tired. She was having insomnia. But as a result, that was increasing her symptom burden. And, the more that she was sort of withdrawing and decreasing her activity levels, her symptom burden was increasing because, you know, it, we know that reduced physical activity can increase symptom burden. Now, again, as I said, I'm not a medical doctor, but I'm a researcher. So I was trying to help and I was reaching out to people and I was reading stuff and I was encouraging her and trying to do like a little intervention and saying, hey, maybe like, here's a suggestion. I know it's really hard and I know you're really tired and I know it hurts, but maybe just try to walk a block and then come home because I think that's going to help with your symptom. I'm reading that it helps with neuropathy. You know, I don't know the outcome of my intervention because this was not science. This was my best friend that I was talking to, but I was encouraging her to do these things. But I realized when and I'm happy to say she's doing great, two-time cancer survivor in remission, and she's back to her social self, very active. But I thought, you know, is this phenomenon happening to other cancer patients who are on therapy, and how can we best support them? But I needed to have some evidence. I needed to study it. And also I'm making it seem as the social connection started it, but I don't know what started what or how they feed back together. I want to study it over time. That is what I propose to do. Um, because again, I think that these three processes during cancer treatment can become disruptive and lead to, all three of them can feed back and then lead into my hypothesized vicious cycle. So I'm recruiting 200 participants from our hospitals. Right now we have 150 patients. So we only have, I think we have one more year. So we're almost complete with this study. I'm going to share some preliminary data, but just keep in mind this is not a study that is complete. Patients take surveys at 4 time points. So near to diagnosis, by that I mean within 3 months. Okay, we don't like to approach patients. We give them at least a month after their diagnosis because it's such a difficult and turbulent time. But we try to get them, around diagnosis when they're just, kind of sort of beginning their therapy. And then 3 months after that, and then 6 months, and then 12 months. Because I wanted a longitudinal, I wanted a study over time to see how these processes unfolded. And then at each assessment period, we give patients an accelerometer. They wear it. It's pretty non-invasive. It's like a watch. They wear it for 1 week at each assessment period. And that gives us some insight into what their activity levels are. Again, we're not talking about, vigorous exercise, but just how much they're walking, how much they're doing, how much they're moving. And of course, we compensate patients at each assessment period for their time and incredible graciousness for being in our study. And then we have a full complement of social measures because, as I said, we want to understand the different effects that these, I have explained, loneliness and social isolation aren't the same thing. So we want to understand what is associated with what, right? We want to be very distinct about what we're finding here and how we can distinguish them. So we have loneliness, we have social isolation, and we have this other measure that's called ability to participate in social roles or social role. And what that is how much someone can sort of show up in their daily life, in their social functions, like going to work, seeing friends, being with family, doing the sort of activities of daily living in our social structures, because it's a measure of how one is kind of returning to normal in cancer, right? After one's, um, diagnosis and treatment. We're looking at social support, as I've described. We are also looking at their social networks, and we're also collecting information on their social traits. And interestingly, I am not a psychologist. So in doing this work, I do have one of my co-investigators is a psychologist, and he said, we need to understand who these patients are when they come into the study because all of us are different. Some of us are extreme extroverts or very social, whereas others are just, not that social in the first place. We have traits, we those are things that are unchanging about us. So we also need to understand, how people come into the study. Cancer doesn't really, necessarily change our trait, right? So that's an important thing to measure. So I'll just give you a little bit of insight into what we're finding. So this is social role, and as I said, that is a measure of sort of how one is meeting their sort of everyday social commitment. And so higher level of social role means that one is doing well with meeting it. So around diagnosis, as you would expect, it's fairly low. But as you can see, this curve goes straight up. So this is good. This is the good news. And this is just a mean average over the entire sample. But what we can see is that this seems to suggest a story that says our patients are kind of recovering in their social roles in their 12 months post therapy, or some of our patients are on lifelong maintenance therapy. But regardless, it's after their sort of first line of treatment or um, their diagnosis, they seem to be recovering at 12 months. But then let's look at loneliness. So here it's the opposite, which means that higher levels on my graph um, are higher levels of loneliness. So around diagnosis, loneliness is, it's not down here. It's not the lowest, but it's what I would call a low to moderate level of loneliness, what we might expect to find generally. But by 3 months post baseline, this shoots up and it doesn't go down. And that's disturbing because it does not have the same curve, right, as our social role where we see these patients recovering. What we see here is a clinically significant actually level of loneliness that just continues over time. So we need to do more work here and really understand what does that mean? Who is experiencing, because this is just the entire sample over 4 assessment periods. We have to look at gender, we have to look at race, ethnicity, we have to look at age groups, we have to look at symptom burden to understand really like who is at risk for this high level of loneliness. And we have to look at what predicts this loneliness. What are the factors involved in it so we can meaningfully intervene. So I talked to you a little bit about social networks, but I think it's helpful to see what I'm talking about. It's kind of interesting. So what we do is we have a special software program. We ask our patients to name 10 adults, not children, but over the age of 18, 10 adults that you know and who know you that you've been in contact with for the past 3 months. And then we ask a whole series of questions about, did you talk with them? Do you feel close with them? Have you talked with them about your cancer experience? Um, are these people you know in real life? Are these people online? But I cherry picked one question, which was, in the past 3 months, who did you do physical activity with? Because we can graph that network. So I want to show you one patient because I found this patient particularly interesting. This is a female patient, age 38, who's a breast cancer, has breast cancer. And so this is, I only have 3 of the assessment waves because remember the study's not over yet, but I'm going to show you the social network. So first of all, what's important is to show you, this is the patient in green. This is our patient, and this is who the patient has named. What these lines mean is, obviously she knows everyone, but if there's a line between them, that means they know each other. Okay. And if they're yellow, that means that these are people she has named that she has been exercising with. So this person doesn't know this person. This person does know this person. And these 2 people are people that she's named that she is exercising with. The closer they are to her is the closer the ties. She has a stronger emotional tie with this person. So this happens to be her partner. It's another person. They seem to be exercise. She's named them as exercising with them or being physically active. Let's not say exercise. But here's interesting um, in wave 2. Now this person is still on active therapy, in chemotherapy, has reported high symptom burden, high level of fatigue, but she's actually increased the numbers. She's gone from 2 to 3, and they all know each other. Okay, they're forming this network here of people. She's got other people on the periphery that she's named that she's been in contact with, but she's actually exercising with 3. Sorry, that's our patient. And here she is again. And look, now she's got this tight little cohort of people, and it's increased again at wave 3. So this is, when I say wave 3, I mean she's now um, baseline 3 months, 6 months. So she's probably just finishing her therapy. When I looked into the record, what I understood was, as much as I can tell, this person is suffering from high fatigue and is walking. So I'm just speculating here, but um, she seems to have formed a walking group. So it's an adaptive mechanism to, um, to address her fatigue. It's very interesting because we can see here that she's actually, it seems like she's positively um, adapting to treatment by engaging in walking. This is her network. So we can look at these social networks for many, many things, not just physical activity, but for who they're talking to, who they may be confiding in emotionally about cancer, and for social support. But I wanted to present this to you because it's kind of good news to be able to see that this is a person who has proactively formed a walking support group. So hopefully the impact of this study, why am I doing this? I really want to look at these patterns of social connection after a diagnosis for young cancer patients to understand who is at risk, to understand if that vicious cycle that I observed is actually, um, you know, relevant, if we're seeing that, if and to understand what is predicting what, since we have, study over time, what starts the cycle, uh, and how does our social connection, the social health of these young cancer patients, how does it interrelate with their health promoting behaviors? Are they adaptive like the patient I just showed you, or for some, are we going to see, change like negative changes? We need to understand the risk group and the pattern in order to meaningfully develop interventions and strategies. That is my hope with this study. So I want to end by just asking the question, what can we do to improve our social health? And when I say we, I'm including myself in this because in the process of, creating this presentation, I thought a lot about my own social health. So this is advice both to myself. I have to follow my own advice and to everyone here. Um, but again, I'm not a psychologist. I'm not an MD. These are just common sense suggestions that I wrote for myself and for all of us because it really was, even though I've been working and researching in this field for years now, I recognize that I need to take my, just like I have to take exercise seriously, I need to take my social relationships and social connections very seriously. I would say that the good thing is we're all here together on this Zoom call, which is a cancer support group. So we're doing something right, I will say. But the very first thing that across all the literature says is you have to recognize the issue. You have to recognize and consider the importance of social connection in your life. We're already doing that, okay? But many people don't realize how important it is to our health. So that's the first part. We also have to tailor our strategies and think about what does social connection look like for you? What uniquely do you need? Because we're not all the same. Okay. For some people, we're very extroverted. Some people are kind of introverts. Some people are introvert, extrovert. Like it's changes for everyone. So that's what I've been thinking about recently. What are my unique needs? How can I best meet them? Across studies again, reducing distraction. We know that a part of what's kind of causing this epidemic of loneliness has to do with our intense distraction and the intense amount of information and social media that we're exposed to and engaging in. Putting our phones down, putting our screens down, giving our full attention, not just to others, but also to ourselves, giving us some time away from distraction really does help improve our connections. Finding community, okay, and considering the range of community groups, all the way from faith-based to things like today, cancer support groups. But there's also walking groups, there's, community gardening, there's professional organizations. This is definitely something that I feel that, all of us can find community. Practicing gratitude and service. This is really key. Um, Giving time to causes we care about and altruism, um, and practicing kindness really does strengthen our social bonds with the world. It causes us to look at the world with new eyes and with a spirit of hopefulness. I'll use a political metaphor because it's election day, but thinking about, reaching across the aisle, whatever your aisle is, to others, and just engaging in kindness with strangers does give you different perspective and creates a sense of social connection, not just with your loved ones and close others, but with everyone. And also there's help if you need it. Really seek help. Don't think you can, you should, this is all on yourself. Talk to your healthcare provider, ask for the support that you need. There are resources, and I think it's really important if one is feeling lonely or one is feeling, that their social connections are not what they want to be, that it might be a good idea to seek help. And with that, I want to say thank you, first of all, to all of you for attending the talk, and to my team and my funders, but most of all to the incredible participants of my study. So thank you so much. And I will take questions. Let me stop that and see what questions I have. Okay, let me answer these. All right, the first question I have is, how does frequent reading or entering a challenging master's program combat dementia or cognitive decline? I can't speak with authority on this because I don't really know. But I have heard from the literature that challenging cognitive activities and reading are really important to helping, prevent dementia or cognitive decline. So I would encourage that basically. I try to read and do all manners of kind of cognitive things. So I hope that helps answer that question. I'm not an expert though. Okay. How do exercise and online communities over Zoom help? Um, I can't speak with authority to that, but I would say that I think they help a lot. I think that online connections whether it's exercise, support, social support, whatever. I think that, that nothing has to be in person. I do think it helps quite a lot to engage in them. Let's see. Can we sign up on a list for future studies in general? Is it only for USC patients? Actually, right now, for this study, it's only for USC patients, and we've expanded to MD Anderson in Texas for various reasons, and mostly because we just want to be able to ensure that, we can, we need to be able to, access medical records with permission of the patients. But, by all means, send me an email. And if there's a study I know that is open generally, or if we open a study generally, then I certainly can let you know. Okay, so this one I think I answered, but it's a great question. Does your level of introversion make a difference in how you fare? Absolutely. What a good question. So, like I said, we all come into the world, we all develop different traits of social traits. So I think it makes a huge difference. What if you're an extrovert or if you're an introvert, because you may not need as much social connection as others. How that said, one of the things that I want to emphasize is that the studies that have looked into social isolation have shown that even in the absence of loneliness, that it does affect health outcomes. So what I would say is that introvert and people who don't necessarily feel lonely, it still may be worth it to try to enhance some connection on your own terms. There's some evidence to say that, that even if you don't feel lonely, but you are not having contact, what that contact may look like may be very different, though. You could tailor it to yourself. It may not be necessarily that you're, going out to big parties with people, but maybe you decide that you want to participate in a community group or something which kind of like, you is not necessarily individually focused, attending webinars, keeping a contact with the world. Again, tailoring it to you. That's a really interesting question. I hope I answered that. How relevant is the activity? When I'm undergoing treatment, I stop going, yes. Yeah, this is the issue. A lot of patients do because it's really, really hard. And so I'm not here to minimize the difficulty and um, the many, many side effects and fatigue and experience that people have on therapy. But what I would say is, um, just like I said to my friend, it's important to try to get some activity because it can help reduce your symptoms. And, not being active creates a feedback loop. The more inactive you are, the more inactive you're going to be. So even if it's walking, you know, 10 steps a day, doing that 10 step can be very, very helpful to maintaining your, reducing the side effects that you have and like that 10 steps might turn into 15 steps. Okay. Um, okay, I think that is all of the questions that I have.
Um, well, we have just a couple of minutes, but I have one question
Yeah,
for you.
absolutely.
It's one that we received at registration, and I thought it was so interesting. Is there any data that shows benefits to in-person social gatherings versus virtual gatherings?
I think this is really a excellent question, and I believe that there is some evidence. So what I will say, and the reason I'm sort of stuttering about this is because this has become a huge focus of research now, especially after COVID. But actually, what I found, in the cancer research, at least, is that there's not that much of a difference.
Mhm.
Honestly, there really isn't. We're not finding huge amounts of difference. It's the quality of your interaction. And the quality of your interaction can be excellent online or, over Zoom. So now that's not definitive because we don't have really large studies and robust evidence, but I would say that the evidence now is not showing a huge difference.
Thank you. That's really helpful.
Yeah. I mean, I encourage, I don't think all of us can, and many of us are not in a position to be out in the world that much. And so I encourage everyone to, connect online with people and connect over support groups or just, you know, text your friends.
Thank you. Thank you. Uh, well, we have reached the end of our time together, and thank you, Dr. Miller, for just your generosity of time, sharing your expertise with us, your personal experience. I know I learned so much about social connection myself, and feel a number of challenges that are good takeaways for me personally. And I want to thank our attendees today for your engagement, for your thoughtful questions. We really appreciate your participation. And I think we have one final slide that we wanted to share. So we'll do that before we go. Great, thank you. And these are a couple of events. One is an event that we have coming up, and the other is talking about groups. Are people living with cancer support groups? Just one sample of group that we have. We have so many support groups. So if you're interested in one of our support groups, you can scan that QR code, or you can also email info@cancersupportla.org and we'll get you started. The second flyer is an in-person social event at our center. It's called Create and Celebrate. We'll be doing some crafts and activities here in Cancer Support Community on November 20th from 2:30 to 4:30 p.m. And we'll have a great time together and invite you to join us for that event, and also join us for all of our online activities and groups that you can find at our website. Thank you, everyone. Thank you, Dr. Miller.
Thank
Uh,
you so much.
yeah, and have a great day, and we'll see you at the next educational webinar. Have a good afternoon. Bye.